Well, welcome to this last lesson of this course for the team on occlusion, where we've looked specifically at the periodontium and dentition. In this last lesson, I want to show you how I use one of my favorite tools that really helps bring everything together, which is the Great Lakes Tutor, TMJ Tutor. I use it for patients on a regular basis, and actually dentists as well, because it really helps bring the entire system together and appreciate how it's working and what maybe we can do to make everything better. So let's take a look at how I use it and how maybe you might be able to use it as well. So as we take a look at the board here, what you can see is, and this is the same way I would go over it with a patient, is you've got the mandible here with the lower teeth on the front and through here, and the upper teeth in through here. What you can see in the back is that, and this is the way I discuss it with patients, you've got the ball that goes in the ball and socket that we've talked about. And if I move this little guy out of the way, you've got the socket where the lines would actually line up in the ball and socket. But as we've talked, we actually have a little piece of cartilage that goes right in between the ball and the socket that stays right in between there. So the lines still line up. That little yellow piece of cartilage is in between them. The teeth line up together, and the muscles are working in harmony and relaxed with each other, so that when we go and open real big, as we talked before, the ball actually comes out of the socket. The piece of cartilage actually moves with it all the way down, so we can open real big. And when we come back together, as we close together, the ball lines up in the socket with the cartilage, and all of our teeth touch evenly and simultaneously. So the only thing we really don't see on here very well is anterior guidance, but we get the whole idea. And so what we saw, and I would say what we saw, Mr. or Mrs. Jones, with you, is when we looked at the way your teeth come together with the ball in the socket, we noted that when you lightly come together, that it was just some back teeth that touched back here. But you mentioned to me that when you bite, when you squeeze your teeth together, you can actually get all of your teeth to touch, and it feels pretty good. But what we had talked about, again, is when we look back here, is when only the back teeth are touching, the ball is in the socket, and even that piece of cartilage is there. But yet when you squeeze together, let's keep an eye on the back side here, when we squeeze our teeth together, the ball comes slightly out of the socket. And we had talked about that. And the other thing I want you to look at is all these muscles here. And what you can see is that when we squeeze together, all of these stretch a little bit, and they have to stay stretched just to keep your teeth together. And oftentimes when we talked about, you also had that little click, oftentimes that little disc is a little bit farther forward, and as you start to open your mouth, you sort of pop on, and then sometimes you'll pop back off. So you can imagine popping on, and that's a little click you hear, and then popping off. So what can we do to help prove to ourselves that we can create some comfort and you might like it? Well, we talked a little bit about creating an orthopedically stable position by using a bite splint. And what the bite splint does is we put it over your top or bottom teeth, and therefore you can now open real big and the ball can come out of the socket. And when we come back together, we make the splint so that all of your teeth are touching real evenly and simultaneously, just like we said would be ideal. And you can still move forward and back on it, but anytime you want to bring all of your teeth together, they feel really good and really comfortable with the ball in the socket without having to have these muscles stretch out all over. And again, by using this appliance, we sometimes can retrain muscles, or at least help you feel how it would feel like to have this ideal bite in through here, so that when you open real big, the ball comes out of the socket. As you come back together, the ball lines up with the cartilage, muscles relax, and all teeth touch evenly and simultaneously. We can, by the way, before we move on, we can also do that with a posterior bite, which I want to show you here. So although we don't see a lot of these, it is made so that, again, Mr. or Mrs. Jones, when you bit together, not all of your back teeth touched, but when you squeezed together, you could get most of your teeth touching, and it felt pretty good. But again, the ball came out of the socket, and it can even be backwards, right? And so same thing, everything happens with these muscles. They have to strain a little bit to get the teeth to touch. And so what we'd like it so that when you bring your teeth together, we would like the ball to line up in the socket with the cartilage, but that doesn't seem to be working right now. And so again, we can put a splint in through here and talk about the benefit of a splint to sort of retrain or feel comfort, so that when the patient bites together, that everything back here is doing its job. So ball is in the socket, muscles are relaxed, all teeth touch evenly and simultaneously. Now, if that feels good to you, Mr. Jones. The neat thing is we talked about doing a little dentistry, and oftentimes we can reshape teeth while we're doing dentistry, or sometimes just reshape teeth so that after we're done doing the dentistry, I'm going to take the splint out here. After we're done doing the dentistry and maybe reshaping teeth, and we'll put the P in the right direction here, that now when you bite together after reshaping the teeth and doing some dentistry, you can open real big, the ball comes out of the socket with the disc, and when you come back together, we've made it so now that your teeth touch evenly and simultaneously with the whole system working in harmony together. And we can use this in so many different ways, this tool. It's really one of my favorite tools that brings the whole system together, and I'd be happy to work with anybody on using it in their practice at any time. I really love it. It's a great way to bring the whole system together while talking to our patients. So we use the TMJ Tutor to really look at the system as a whole and how we would use it for our patients or just education for you, the team. It's good for anything. We've learned a lot in this course. We've talked about the periodontium and how it's related to occlusion. We've looked at why teeth look like teeth and how they function. We've then incorporated muscles and joints and really looked at the whole system. I've had a great time doing it. It's one of my favorite topics. I hope you've gotten a lot out of it, and I'm looking forward to seeing you at the next course.